40 years ago, I used to exercise racehorses. We were cantering along and I saw a board with a nail sticking out of it. So I swung around to look again because I wanted to get rid of it. But if you want to fall off a horse, you look down, and I looked down and she bucked and off I went. And I was fine, but I kept thinking to myself, she's a racehorse, she's worth hundreds of thousands of dollars. So I grabbed for the reins and she kicked me. And of course there was no blood, it was all internal bleeding. It was a long operation, 5 hours. If I hadn't had lots of blood transfusions, I would probably have died. I remember as they were wheeling me away to be operated on, I said, "Do what you have to do, but I have to be riding by Saturday. I have a very important lesson." So I wasn't quite aware of the severity of the situation. My name is Laurie Cherbonnier. I was recently diagnosed with hepatitis C. They think probably I got it after the blood transfusions that I had at the time.
Hepatitis C, by and large, is a silent disease. So most patients who are infected have no idea that they have the virus. About 1 in 5 hepatitis C patients left untreated will develop advanced liver disease, cirrhosis, and all its complications. For a number of reasons, baby boomers have, statistically speaking, the highest risk of being infected. The hepatitis C screening program was initiated last year. Our goal is to screen the entire North Shore baby boomer patient population over the next 5 years, using the electronic medical record system to automatically trigger an alert to the primary care physician. Ms. Cherbonnier was referred by her primary care physician, who followed our new alert and tested the patient. She never had abnormal liver tests for decades, and she was completely unaware of this infection. In those days, blood transfusions were not tested for hepatitis C, so this shows the power of a population-based screening.
When I went to see Dr. Fimmel, obviously I was a little nervous, how bad is this? He was very reassuring. He did a test on me, he said my liver was in very good shape. They have recently discovered a new medicine. It used to be interferon, which is very unpleasant, and now is Harvoni, which has very limited side effects. Baby boomers have a higher incidence of hepatitis C, so I've been telling all my friends to get tested. And in fact, I've been told that I could have infected my husband, and my 2 daughters, when I gave birth to them, could have it. And I probably would not have been tested had I not gone to Dr. Patel. So I think, it's worth it to get tested, because then you know. I knew that you can get things from people's blood, and I've just always been grateful for every year that I've had since then.